I am so excited today. We are going to have a show where we are going to talk about how pregnancy and postpartum affects your gut. So today we have Dr. Veronica Gerardo, who is a board certified gastroenterologist with over a decade of experience in diagnosing and treating a wide range of digestive disorders. Dr. Gerardo is not just a board certified physician, but she's also a mom. And she is postpartum. I don't even know if it's like a couple weeks, couple days. So the fact that she is joining us on this show is just absolutely amazing. And she's close to it. So she can really give us advice that is pertinent and that really resonates with you because she is exactly where you are. So, Dr. Gerardo, thank you so much for coming on the show. I'm so happy you're here.
Thank you. And thank you, Dr. Choa, formally, as for having me on the show to discuss the gut. It's not the prettiest of topics, but it's a very necessary topic to have because we all have a gut and we use it every day, whether we like it or not. And as you said, yes, I just had a baby. He is currently 6 weeks.
Oh my
So very new.
God.
And I experienced everything that in terms of the changes that your body makes because of hormonal changes. So I'm very excited to discuss that and be new to the journey again because it's been a while between my first and this current baby.
Yeah, I think we really underestimate how our gut is involved in so many aspects of our health. I have always had issues with my gut just myself, and I think about back to pregnancy and all the changes that I experienced, and I may not have attributed it to pregnancy in itself until years later. And so I think that it's super important that we recognize that several changes that the gastrointestinal system goes or undergoes during pregnancy and postpartum, and that these issues are really unique to women. And if women can identify that, then they can really get the help that they need. I'm taken back to just my journey of pregnancy, and I'm thinking about the things that I experienced. So, GERD, acid reflux, constipation, just being pregnant. What are some conditions that a lot of moms struggle with during pregnancy that are a result of carrying this little baby inside?
Well, you basically said it. There's a lot of them, but the ones that are common that all of us are probably going to get when we get pregnant is acid reflux is going to be the one, or GERD is the formal name. Constipation is going to be the big one.
Why do pregnant women get constipated? What is happening?
So like when you get pregnant, that hormone that affects everything is progesterone, and it does a lot of things to your body. When we talk about the gut specifically, it can basically slow down gut motility. So because when we think about the gut, I'm not trying to nerd out here, but when we think about the gut, it's all based on a motor system, right? It's just like a motor, it kind of moves and daily, and everyone is a little bit different, but we know that it kind of moves and move things along to get through the GI tract. When you get pregnant, things slow down because of that progesterone hormone. So you might not go to the bathroom as much or as quickly as you did a just
Mm.
spell stool because the hormone is slowing down that motor system.
Interesting. So progesterone is to cause. So all these interventions, when they're telling us to, eat prunes and eat all these green leafy vegetables, is that actually helping? Like, are we actually doing?
Yes, it does help. Because like when you actually talk to your doctor, they're going to tell you, oh, increase your fiber intake anyway, or use a fiber pill, or they'll give you something like Miralax or Dopalax, which is basically what fiber does if you eat fiber when you're pregnant, or even regardless, is it kind of helps with getting the water into the gut, but it's a double-edged sword. So if you don't drink enough water, then you'll get constipated. But if you drink enough water, then it help with the transit. So yes, it does help. Some people might need a little bit more help, and that's what Marilax does. It just gets the water into to the gut to allow it to then you didn't have a bowel movement.
Mm. So I think about once I got through pregnancy, so I was constipated throughout pregnancy, right? And then there was a childbirth process. And I think my constipation actually got gradually worse to the point where I actually was finding myself using stimulants and laxatives to be able to have a bowel movement. And then that eventually led to me seeing a gastroenterologist. But this was, I want to say, 2 years after I had a child. Okay. why this episode is resonating with me so much, and I feel like it's important. It's not pretty, it's not, sexy. We're talking
No.
about constipation and the gut, but I'm trying to save women the time that of struggling because I struggled for 2 years. And I went back and forth with, my primary care physicians trying to figure out what was wrong. And I finally found an amazing gastroenterologist, someone like you, who sat down with me. I remember he spoke to me for, I feel like it was like an hour. He sat down, he took a thorough history with me. We talked about my diet, what I was eating, how much water I was intaking. He talked about my family history. And at the end of it, he scheduled me for all these tests to try to figure out what was going on with my constipation. And at
Mhm.
the end of all of that, at the end of all of that, he told me that the cause of my constipation, it wasn't my diet, right? It
Mhm.
wasn't my water intake. It was my pelvic floor.
Yes. And even when I tell people that, people are like, what are you talking about? Because and then I'll, just like you said, get into sometimes the cause of constipation can be getting into that history, right? Like getting into your birthing history is one thing. And sometimes even as a woman, because we use our pelvic floor for a lot, just being a woman actually
Mm.
affects us a lot, even in older age. So yes, yes. If you have a good gastroenterologist, all you need really is a good history and a good physical. You can solve a lot, as you remember what they told us at Pitt. That's the biggest part of medical care.
Yeah, it really boiled down to talking because I think as a mom too, you don't really understand the changes that your body is going through. You're not really in tune because you don't really know what's normal or not. And to be honest with you, when I was constipated after I was pregnant and had a baby, I wasn't thinking this could be it. I'm thinking, why the heck am I constipated? Is it my diet? Like, what am I doing wrong? Do I have cancer? I wasn't thinking that birthing a baby could have this effect. And so I went through this whole process of suffering for 2 whole years, 2 whole years until, a physician took the time to talk with me. And we went through some tests. One of the tests that I think that was the most helpful was I got an MRI
Mhm.
of my pelvis and some other weird tests where they not pretty, where they like basically are checking the function. You have to get an MRI where they're checking, seeing when you're having a bowel movement or not. Is very bizarre and a little embarrassing to talk about. But that MRI was super helpful because it got to take a look at my pelvic floor and
Mhm.
saw that I didn't have any strength, right? And so after that, when we realized what was going on, he first sent me to someone called a urogynecologist, which is a doctor who specializes in the pelvic floor when it comes to women. And then she talked about surgery, but she was like, we're not there yet. And she referred me to a pelvic floor therapist.
Yes. And like you said, a lot of people, so let me just say this, back up a little bit. Sometimes the issue in terms of the barrier into getting this type of care is sometimes it's the doctor, let's be honest, and sometimes
Mm.
it's the patient. Some patients will not want to talk to me about their their pooping habits. Even when I bring it up, they're like, "Oh, it's so embarrassing." I was like, and I always tell people as a joke to kind of lighten the mood. I'm like, "I operate in poop. This is my business. This is what I'm supposed to do. I'm supposed to talk to you about your poop." That's why you see poop like the Bristol scale everywhere to say how your poop is looking. So sometimes it's out of embarrassment, which I don't get because that is my field, but then people don't like to talk about something that's supposed to be private in your
Mm.
bathroom and things like that. But yes, there are tools that we use to basically diagnose that pelvic floor disorder or dysfunction. And like you said, it's not necessarily pretty because even the exam for it is not pretty. Like, if you have a thorough exam for checking what's going on with the constipation, checking the pelvic floor, it involves a rectal exam and it involves you squeezing your rectum and bearing down and them touching you around your rectum. And that's just basically to see how much pressure you can exert on your own. And then it gets a little bit more, it gets accurate with other tests, like the famous one that we like to use, the anal rectal manometry. And it
Yes.
does the same thing. And it does the same thing. And it looks at pressure and it looks at how like when you bear down, like what happens to your rectum and your anus. And also it looks at eventually how quickly you can expel a balloon, so how quickly you can actually poop out the balloon to simulate, you have a bowel movement. And also if you can feel when you actually have poop in your rectum. So, but like
Wow.
I said,
Oh my gosh. Is that also from the progesterone, these pelvic changes, or is there something more going on when you get to this point and you're struggling with constipation this far out after having a baby?
at that point, is you can't blame it necessarily on progesterone. Like during pregnancy, yes, we can blame it on progesterone. When we get far out, then we have to think about what happened during the birthing part. So a lot of things that happen first time moms is tearing, So
Mm,
we tear during the birthing process, or even if you don't tear, because you're carrying a baby. So the pelvic floor is getting weak over time because you have to carry that baby. So the pelvic floor expand, the muscles kind of expand to accommodate the baby. So things like the pelvic floor can get weakened over time. And then if you have to get a episiotomy, which is that the tear that, a doctor
okay.
would do, then that will affect those muscles because that's that pelvic sling. I'm trying not to use any
Mm.
medical jargon, but like basically it's all the muscles are down there. So later on, it's because of what happened with that muscle for the pelvic floor.
Wow. Is there any group of people that you would say, hey, you're at risk of having pelvic floor dysfunction, which could lead to complications such as constipation? Is there any particular individual you would say is high risk for developing issues like this?
So anytime I encounter a pregnant woman or a person who had been pregnant, I always use that's always on my differential. Multiple births, of course, vaginal births, because those are where you were tear. And if you did tear, and if you have multiple tears, then I would think that will be where we are, especially if we tried everything like you did. You tried medications and diet and things like that, then I'm starting to look at like what else can we do? Because the first
Mm,
thing we do as GI doctors is not necessarily go to anal rectal manometry. We do a lot of medications. But so if you keep coming back and you're like, nothing is working, then I'll start thinking about, let's talk about your pelvic floor a little bit more.
wow. How can we prevent getting pelvic floor issues? Is there anything that a woman can do during pregnancy to protect their pelvic floor from getting to the point where this may happen?
So pelvic floor exercises, and I will say that I'll be honest and say we're probably a little bit behind on that in GI, like during pregnancy, as a preventative measure. But we do pelvic floor exercises as a recommendation for pelvic floor dysfunction once we diagnose it. So if it's good after pregnancy, wouldn't hurt you during pregnancy. So because you're basically strengthening that pelvic floor, you're going to use your pelvic muscles anyway. So basically, pelvic floor therapy, and a
Mm,
physical therapist can tell you a little bit more about that. And some women will do that during pregnancy, but a lot of women will wait because again, they're thinking the constipation is due to this hormone, that progesterone. That's what everyone's going to tell them. Everyone's going to tell them, hey, you're pregnant. Is the normal part of being pregnant. And I will probably even tell you that too, like when you come to me during pregnancy. So they wouldn't necessarily do it, and no one's going to necessarily recommend it, but it won't hurt. It won't hurt you.
okay, that makes sense. Makes sense. So, constipation, ladies, it's not just always just your diet. If you've had a baby and now you're having trouble, difficulty having a bowel movement, and you've done everything you can, think beyond the food, think beyond, the water intake. It could be your pelvic floor. And don't be embarrassed to talk about these issues. Really have a discussion with your doctor. And if you need to, get a referral to somebody who can sit down and do a thorough exam. Now that we talked about constipation, I have another super embarrassing diagnosis that a lot of women face that has to do with their gut. Can you guess what it is?
Mhm.
Hemorrhoids. Hemorrhoids. I have had women, my patients, say that these things are worse than giving birth itself, right? And women will go their entire pregnancy without a hemorrhoid. They will give birth, they may not notice something. And then those couple weeks after giving birth, they have these large masses sticking out of their rectum, and they are having the worst pain of their life. Number one, they're thinking, is this permanent? Am I going to have these things literally poking out of my rectum forever? Number two, how can I get rid of this pain without surgery? And three, what the hell? So let's break down hemorrhoids.
Oh yes, the hemorrhoids, that's another one that people are rather embarrassed to find out during a colonoscopy. When I tell them they have hemorrhoids, everyone's like, "What? I have hemorrhoids?" I'm like, everyone pretty much have hemorrhoids at this point. And it's also, let me just put my little get on my soapbox about hemorrhoids. It's also because the way we use the bathroom in this country,
Mm,
like the like
yes, I'm gonna when I went to pelvic floor therapy, one of the most life-changing interventions they had for me was the stool.
yeah.
Okay. And it
Mhm.
has forever changed how I use the bathroom. I use, what do they call it? A potty
Squatty
stool?
potty.
A squatty potty.
Mhm.
I have a stool in the bathroom, and that is how I have a bowel movement. And the reason my pelvic floor therapist recommended this was because also on my MRI, I had an outpouching, something called a rectal seal. So instead of my bowels going straight down to have a bowel movement, I had a pouch which came as a result of pregnancy and childbirth. And so by changing the angle at which I had a bowel movement, the stool can flow easier. So most of us sit like this when we're having a bowel movement, but they actually recommend that we're at an angle so that the stool can come out easily. So plug, get a stool.
Yes. Yes, get a squatty potty. And because like in other countries in the world, when we're not sitting on the toilet, they squat.
They
And then
squat.
they don't fight against gravity. Us in this country, in the Western world, basically, we sit on the toilet and we fight against gravity. And then that also can help with this hemorrhoid getting worse and things like that. So hemorrhoids is another thing that does happen regardless. It can happen because you're constipated all the time or you're sitting on the toilet a lot, and
Mm-hmm.
waiting to have a bowel movement. And pregnancy is a big one because of all that straining. And hemorrhoids are just blood vessels at the end of the day that are coming out of the rectum. They hurt because the nerves, and then they can also bleed, which is why they can be a cause of like the bleeding. Sometimes when you wipe and you see blood, or sometimes it can cause a lot of bleeding for some people as well. And like I said, I never try to diagnose the bleeding, just go to the doctor. But hemorrhoids, the what I would say, like the first line of treatment is again, if I find out that your hemorrhoids is because you're constipated or something like that, it's the same thing that you were talking about, increasing your water intake, increasing the fiber intake, especially if you're going to do fiber, you need a lot of water. You might get drugs to basically help you get with that, the famous one being Linzess. But if it becomes a problem like it causes bleeding or causes a lot of pain, there is a possibility that we can actually help with the hemorrhoids without surgery if we did all the medications over the counter things.
What are the
Uh,
over-the-counter medications, just so we can get those out of the way?
okay, so like if we're going to do over counter treatment, we could do like a sitz bath, which is like you sit in Epsom salt with warm water with Epsom salt in it and kind of just sit to kind of help with that. You could do preparation H, Tut's pad, which is witch hazel, and those are basically the over counter things. In terms of like constipation relief, that would be like the Marilax. You don't have to take Marilax; it can be anything generic in that
Mm-hmm.
form. I think it's Clearlax another generic one, or Dulcolax or Senna. But Marilax is what we like mostly as GI, so that's why we push it on you because again, it isn't toxic to your body or anything like that. Now, one group, but we're not going to get into that. That's more that's more like as a medical blah blah blah. But if we're talking about over the counter stuff, it'll be the preparation H. Now, if you tried everything in terms of diet changes and medication and Linzess and all that, and probably help, but you still have like some pain and you still have some bleeding and it's internal, we can do hemorrhoid banding for internal hemorrhoids. And that could help. It's basically what it sounds like. We go in, I usually go with the scope so I can like visualize this. So if I'm doing your scope anyway, and just put a band around it, and the band will eventually fall off and then cause scar, and they might pull up those other hemorrhoids that are on the outside. Now, if you have external hemorrhoids, that is unfortunately going to be a surgical
Mm.
hemorrhoid.
Yeah. I think one of the things that a lot of women want to know is like, how long do I suffer before I get the help that I need, right? Do I jump to having surgery or do I keep going with the over-the-counter stuff? So you talked about preparation H, which is basically steroids, I believe. Some people have found some help with, I don't know how you feel about topical lidocaine, like a numbing medication. Some people
Yeah.
find help with that. And so I know over time these things get better. Is there activities that women can do to sort of like ease it? Because I know obviously gravity make things worse and straining. So just give us some like non-surgical options because I know moms don't want to have to go into the doctor's office. They don't want to have surgery unless it's like absolutely necessary. But is there any activities that they can avoid or things that they can do to ease the discomfort and make it not get worse?
Okay, I would say like one thing I'll say like even if you're trying to avoid the doctor, if you're having any rectal bleeding, I will always say please go to the doctor. Like I would say if you
Mm,
come to me and I don't care if you're in your 20s and you tell me that I see a little bit of blood in my stool, I'm going to do a colonoscopy on you because at the end of the
mm,
day, that's one thing, especially in our era currently, a lot of people are being diagnosed with colon cancer. So that's why I say if you have bleeding, just go to the GI doctor and get that looked at and get out the way. Now, if you're not, and you're like, okay, I know this are hemorrhoids and I want to basically treat this at home, it'll be a lot of things already said. So, like, yes, you can do the over-the-counter medication. If that doesn't work, you can actually go to there. We have better medications or better steroids even that you can get from your doctor. And you can talk if you were a patient of mine and you basically came in and had hemorrhoid issues, I might just go ahead and say, if you called me and say, hey, this over-the-counter medication is working, and I can order you something, that's basically stronger. Like I said, fiber intake, water intake, exercising. It like one thing some people can put a lot of strain on that pelvic floor again, like with how they're lifting and things like that. So if you're having a lot of
mm,
problems, you probably should wait until like that part is, like that irritation is probably over with. But I wouldn't say stop exercising. You can still exercise. It's
mm.
probably what you're doing at the moment. So and if you're getting constipated, that would be the biggest thing because constipation does play a big role into hemorrhoids. So we have to treat constipation again.
If women are struggling with this and are struggling even just having that conversation, how would you encourage them to talk to their doctor or get the help that they need? Because I always tell my moms when you're about to go to that 6 week appointment with your OBGYN, write these things down so that you can
Mhm.
have these conversations. But like I said, a lot of them get nervous or they may not write these particular issues down. Where do they start? How can they get past that and just converse in order to reclaim their wellness and get to a place where they can function again?
Well, I think one of the things that if you're going to the OB/GYN doctor, I think it's just being honest and like, hey, this constipation is causing, and you don't have to go into details about like how much you're going to poop and how it looks, but like
No
basically
pictures.
like, yeah, like that's what I would do. I'm like, how does it look? How many times a day? But if you're going to your OB doctor or your primary doctor and you're bringing up like how it's affecting your wellness, like your mental health and things like that, and your happiness and or your quality of life. If you say this constipation is affecting your quality of life, that would more than likely ring bells for a lot of people. And then they probably will send you to a GI doctor. What I find sometimes is that it's easier for women to talk to other women is what I found because
Mm,
even like I'm the only female in my practice. So when I would inherit sometimes patients from the males in my group, it's not because they didn't do anything wrong. It's because the women didn't talk to them because they were men and they were embarrassed. So
mm,
sometimes it's easier just to find a practitioner that's a female, right, to talk to. And then women are more likely to then share like their issues. But if you don't have that in your area, because let's be honest, like there's not a lot of female gastroenterologists. We're working on that, but it's still a lot of work that needs to be done. So in that case, it would have to be you have to advocate for yourself in some way and just say, hey, my quality of life is being affected by my bowel movements. I'm in a lot of pain. Just name the symptoms. I'm in a lot of pain, or I have a lot of discomfort. I can't do the things I want to do normally. And that should ring bells for a physician to then start looking or refer you to someone that can help.
that's good to know. If you had, and on that note, if you had, three pieces of advice, whether stemming from your personal experiences or your work experience, what would you want to tell our women when it comes to their gut health?
Yeah, the gut health is a big topic outside of just postpartum
Mm,
constipation because there's also irritable bowel syndrome. But I would say like your gut plays a big role. And when I have a conversation with patients, I always say your gut plays a big role in everything, in your wellness, because there's the gut brain axis. And
mm,
sometimes, the brain can actually play a role in your constipation, even, outside of your
interesting.
pelvic floor. And for that is biofeedback therapy that will help more than anything and not so much probably pelvic floor therapy. That's more of a your muscles aren't working the way that they should be doing. So if your gut is kind of out of whack, or if you're kind of depressed, then your gut reacts to it because again, your brain and your gut's connected. The example I always use is
Mm.
when we're children, or even as adults, but when you're children, when we feel butterfly in our stomachs when we're nervous, that's that brain gut axis work activating. Your brain is talking to your gut. You feel nervous in your or butterflies in your system. That's just the axis that's working. So if things are off, especially for women, we carry a lot of our emotion and the stress in our gut. So if we are stressed and anxious, some people have constipation, some people have diarrhea.
Wow.
But you go to the doctor, it's important to talk about that. Especially if they don't bring it up, you can say, hey, I noticed there's a trend when I'm anxious, or I have a big thing going on at work, or there's a big life change. Now my gut's acting up. So I would say, like, pay attention to the symptoms to yourself and then present it to your doctor. And if they don't present it, you present it. Because sometimes, doctors are very methodical and they're like, okay, we need to do this,
Hmm.
we need to do this. And they probably thought to ask you the question, but then got bogged down into some other details of the history and physical. And then that could be easily like swiped over. So advocating for yourself, speaking, basically speaking up. Another thing is your physical health is very important, also in your gut as well. Because one thing we will say, like even, outside of constipation, outside of postpartum, and the whole brain gut axis is exercising and taking care of yourself that way. You ain't got to do nothing crazy. You can just do some walking.
Walking.
Yes,
Hmm.
because people think like when a doctor tells you to go exercise that you need to act like you're on The Biggest Loser, and you don't have to act like
Well, Cardi B now out here walking stairs 1 week postpartum. So snapback is real. The snapback culture is real. So
Yeah, I read that and I was just like, she's out here working and I'm waiting to get clearance. And she's like, she's only not even 2 weeks and I'm 6 weeks, but hey, yeah,
hey, the pelvic floor will tell the story.
yeah.
The pelvic floor will tell the story. Listening to you, Veronica, it kind of highlights the importance of having a doctor who has a different experience, right? So oftentimes we go to the doctor and like you say, it's either a doctor is very reactive, you're constipated, meds, 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 or let's do these tests or do these procedures. And oftentimes that like holistic approach is not taken into consideration, whether it's because of time, whether it's just because maybe they're not connecting or getting all the pieces together. And so this is why diversity in medicine is super important, right? You're a mom, right? You've been through the pregnancy process, you've had children, right?
Mhm.
You have you're African American, you know the different diseases that we face and certain risk factors that we have. You just have a very well-rounded viewpoint. And so I can have this conversation with you and I feel like you would take a holistic approach in how you diagnose my issues, how you treat me, and the recommendations that you would give me. And this is what is really important when it comes to our postpartum moms because it is more than just like textbook. Like this is I'm constipated. Here's a medication for constipated. It's beyond that. It's like, what's the mind doing? Are you depressed? Are you having mental health issues? Like, tell me about that. Are you having issues initiating a bowel movement? Did you have any tears when you were pregnant? Tell me about how many children you've had. Like it's taking a well-rounded holistic approach to diagnosing something and making recommendations. And honestly, let's be real, this is not going to be done in a 10-minute visit. And that's where our healthcare system fails us a little bit.
And that's why I said that sometimes, it might take me, and I'll be honest, when I first meet you, I might say, oh, the stress of Marilax, but it might take me, but every time you come to me, my patients haven't said anything, but I ask them again about like their constipation over and over again, even though like we talked about this last visit, I'm like, I know, but I want to make sure I didn't miss anything that first time.
Mm,
And then we'll talk about it again. But it doesn't happen in the first visit. It might not even happen in the first couple of visits. But after a while, after you've done everything, something has to change. Like something has to,
mm,
if it is that brain gut access working again, you trained yourself as a child to not have a bowel movement because it happens a lot to a lot of kids. And that's again I'm not a child doctor. I'm not a pediatric gastroenterologist.
Hmm.
But again, that's that squatty potty thing coming into existence here. Because when my child was learning how to potty, his doctor said, make sure he put his feet on a stool so that he
Mm.
doesn't learn how to not use the bathroom.
Wow.
But I'm getting away from that. So again, it's like sometimes it's behavioral, which is why I plug that biofeedback. Sometimes it is, basically the pelvic floor, and you need to have exercises to basically train that as well.
Thank you so much, Dr. Gerardo, for coming on the show. If our audience wants to reach you or have questions for you, how can they find you?
So via social media, I'm on Instagram. It's Dr. underscore Jarido, Jarido. I'm trying to remember my own name. There's no other one. So it's
Oh my
Veronica,
gosh.
is Jarido. I'm also on Twitter. It's the same thing, but I don't use Twitter as much because I'm confused about it a little bit. So
Is it Twitter or X?
yes, I'm just like, so I just tweet and then people respond. But the Instagram would be the easiest way. If you're local here in Jackson, I don't want to plug myself, but if you're here in Jackson, Tennessee, or the surrounding areas, then I work at Skyline Endoscopy in Jackson, Tennessee.
Lovely. Thank you so much, Dr. Gerardo. And it's been a pleasure having you. We've learned so much today from constipation, hemorrhoids, the brain, the gut, all of that good stuff. So if you all have any questions, make sure to email me at fourthtrimestervoices@gmail.com. All right. Take care. Thank you for joining us on this episode of Fourth Trimester Voices. If you have any questions about today's episode or you want to share your story, please email us at fourthtrimestervoices@gmail.com. My name is Dr. Choa, and it's been lovely talking with you all today. Take care.